The issue that's before us sometimes is, well, does this somehow mean you support the Affordable Care Act? The answer is no, I don't support the Affordable Care Act. I think it was flawed in its inception. I've been highly critical of the fact that the Obama administration not one time even addressed the issue with the states, didn't ask the governors, and yet we're the ones that have to implement most of it. I think the fact that it's so partisan, not one Republican vote, was a mistake by the administration in trying to take care of a health care issue that impacts 1/7 of our GDP. I think the Affordable Care Act is flawed and needs fixing, repealing, or replacing. All of the above can work for me. That being said, we have lemons, and I'm trying to make lemonade out of it. And it may be not as good a lemonade as some would like, but it's better than just having the lemons. And I have to deal with the here and the now and the reality of what we have as laws on the books, and respect the fact that our people, whether you like it or don't like it, are sending large amounts of money to Washington, D.C. in new taxes under the Affordable Care Act. Now, if we can repeal and replace, we'll deal with that future. If we can modify and improve, we'll deal with that future. Elections this November will probably give us a little bit more of an adjustment as far as what's the future going to bring when it comes to the Affordable Care Act. Even President Obama himself says, I know there are problems with the Affordable Care Act that need fixing. So I'm not a big fan of the Affordable Care Act, but I know what the law is, and I know what we're paying, and I want to make sure we get a bigger bang for the buck. With the Healthy Utah program, I believe that to be the case than if we just do a Medicaid expansion or do nothing and leave people kind of in an unfair situation that's been created by the Affordable Care Act and the Supreme Court decision.
What does Utah get? Did you have to sacrifice any amount of that federal grant money in order to create our own program?
No. Again, the good news for the taxpayers of Utah, which is certainly ought to be respected, they are being taxed under the Affordable Care Act about $680 million in Utah. That money goes to Washington, D.C. If we had a Medicaid expansion program, $258 million of that money would come back to Utah to go into Medicaid and Medicaid expansion. I've just said there's a better way to spend the money. I'd just as soon Utah direct the spending of that money as opposed to the federal government. I think we're better at it. We understand our people, our culture better than they do. And so we're taking the same $258 million and redirecting it into the Healthy Utah program, which is more of a private insurance program with more individual responsibility, and also a work effort that's a requirement as part of this overall program. So we're dealing with the whole person, not just their health care needs, but their workforce needs also. And again, it's going to help them take on individual responsibility and have a better health care outcome at the end of the day.